Well, hello. Welcome to the High River and District Healthcare Foundation. I'm Jody Seeley, and today we get to have a fun conversation to celebrate an anniversary at the hospital. So I've got two special guests here to join in the conversation. Please welcome our manager of High River Acute Care, Chantel Hunter, and super mom of three, Lisa McDougall. Ladies, thanks for hanging out with us today.
Yeah, thanks, Jody.
Thanks for
Now,
having us.
the party we're celebrating, the anniversary we're celebrating, is back in 2019. Was it on this exact day, Chantel, or was it this week? Do you remember?
This week, yeah. This
was the week that the renovation was complete and we opened the newly beautiful maternity unit at the High River Hospital. And I don't know, Chantel, I feel like my favorite memory of it is I just showed up and was like, hey, do you want to go on Facebook Live with me and take a tour? And you were like, I guess so.
Yeah,
and I totally put you on the spot, but we got to have this behind the scenes tour of this unit. And so celebrating its third anniversary and the difference that it's making for moms and families in the foothills and area has been pretty phenomenal. Have you seen a lot of growth in the past 3 years in that, Chantel?
It's hard to believe that it's been 3 years, honestly, Jody. The past couple of years have just, really flown by for sure, given everything that's going on. But in those 3 years, we have seen so much positive feedback from our moms and our families on those new rooms, the space that it provides for the support people, and their ability to labor in those new birthing tubs and deliver in there, if they're able to. It's been phenomenal. The feedback has been amazing.
Yeah, well, we'll talk a little bit more about that, but we wanted to touch base with a mom who's experienced. And what I think is kind of neat, Lisa, is I think you said you had one baby pre-reno, one baby halfway through the reno, and the other baby après-reno. So you've kind of had a whole gamut of birthing experiences at the High River Hospital. Can you share a little bit of that with us?
I just dropped off a thank you card to the hospital, actually, and I was like, I hope to never see you again. But love you guys. Yeah, no, it was awesome. So when Kaden, my first, was born, I just remember like the rooms were so small, and then like Vince stayed overnight and they rolled this like crazy bed into the room that filled up like the entire room, and then in the middle of the night he was like tripping over it and like killing his legs and stuff. And then with my second kid, we walked in and we're like, holy crap, like, is this all for us? Like, the rooms are massive. And it was just like such an amazing difference. I didn't have the tubs for my second, but I had the tub for Colby. So they actually started filling it up halfway, and then I gave birth. I didn't quite make it to the tub, but it was there just in case I needed it. But the rooms are amazing now compared to how they used to be.
Yeah, and so much more. I don't know, would it feel like, is it kind of homier? Would that be the experience? Could you explain it that way? Not being someone who has had 3 kids, I can't give you the same response, but is that how it would feel? Like, what's it like?
Totally. No, so for my third baby, Colby, like as soon as we get there, Vince walks in, turns on the freaking TV to watch the hockey game. He turns on the hockey game while I'm like laboring. So that's how homey it feels. You just walk in and make yourself at home, turn on the hockey game. Yeah.
You feel like you're just like, he's on the couch and you're just hanging out, making a baby over here. Yeah.
Don't worry about me. Yeah.
So Chantel, when it came to this redesign, and I think one of the biggest celebrations too in this whole process is that this was community raised donor dollars that made this a reality. So that as community, we came behind people and families like Lisa's to give that homier birthing experience. And is that kind of where the design and idea came from?
Yeah, absolutely. 100% of this renovation was funded through our community and the support and their ability to see our vision for wanting to create, a different, unique experience for our moms that came to the hospital to deliver here. We knew we wanted our moms not to have to move into different rooms, and we wanted them to be in the same space and have that availability to have their support people around them, because that's what's important. Like, to a lot of our moms, they want the people there that are going to help them get through that labor and welcome the birth of, their new baby. So we knew we needed to make space look a lot different than what our old rooms offered. We connected with some of our moms and, a lot of our staff, and we looked to other facilities to see, what they were doing well that we could learn from and then adapt and make our own here in High River. So it was a labor of love for sure to create these rooms, and lots of vision boards on, what could we do? What's possible? So we were able to build 3 LDRP. So that basically means like a single room maternity care where moms can come in, they labor, they deliver, they recover in the exact same room. And then we've got these beautiful labor and birthing tubs in each of the rooms, which, has been a huge addition to our team, and the feedback that we get from our moms is phenomenal. So it was a pretty cool experience to do this.
Yeah. Well, and you can probably attest to that, Lisa, having had the experience in that room. Was probably from, first baby to third baby, the labor experience is a lot different regardless, but having that space where that this is where you just get to stay for the whole time made a big difference.
Yeah, I know, it feels like less like a hospital, more like just like a room that you're hanging out with. And the nurses are so great. Like, they help you every step of the way. So there's room for them to like help you with your exercises to relieve the pain and stuff like that. No, it's like way better.
Well, and I feel like because Lisa's a mom from the community, this is her little luxurious, best kept secret in her backyard. But I know that we have moms that come to birth from kind of all over the foothills, and maybe it still is kind of this best kept secret that we actually want to share with other moms to have this great experience.
Mm-hmm.
Yeah, I always think like, even if you live in Calgary, you should drive to High River to have your kid if you can make it. It's like,
don't wait too long, but it's worth the drive.
Yeah. Even like with my third, I stayed there a couple extra nights, and because there's not a lot of people there, they have the room for that, and it just helped me like heal and recover, and I didn't have to watch my other 2 children. So I just like love that they let me stay, whereas in Calgary they'd be pushing you through right away, like as soon as you're done you got to leave so you can have another person come in, kind of thing.
Yeah. Well, I've said to Chantel many times that can I just book the room to have a bath? Those tubs look so amazing. Like, I feel like we could rent them out as just like escape from your family and come have a big soak bubble bath. We could have bubble baths in there, candles, but
yeah, they were like, you're good to go home if you want, but you can stay. I'm like, I'm staying. This is like a hotel room. I'm just going to hang out here for a bit.
It's like the High River Maternity Spa. But
Yeah.
you got to go home. Yeah. There's that trade-off. So Chantel, for people who, like Lisa says, like if you're from Calgary, you should drive to High River to have your baby. You can do that because we have a self-referral program there.
Yeah. So there's a couple of ways that you can, come into our program. And one of those ways is through a direct referral from your family physician, your GP, or you can self-refer. You can call the clinic, and our amazing unit clerk team will do your intake and get all the information that's required. That is how you can come and hang out with our team. And, the one thing I do want to say as well about the renovation, as beautiful and amazing as these rooms are, there's also a huge element of safety that has increased because of this renovation. And, part of that is just because of the space that we've had. Like Lisa referred to, there's nobody's tripping over anybody. We've got lots of room for our clinical equipment when we need it. And the team is able to practice in a much, safer environment, which obviously is great, right? That's our number one focus is safe and healthy mom and babe. And our team is able to practice in that environment now. So, yeah.
Well, I think even there wasn't obviously foresight in the creation of these rooms thinking, oh, well, maybe one day we'll go into a worldwide pandemic. But the reality of us in that is it also provides a level of safety in that regard, is that you have this room where you and your, birthing partners or your team, like you're all in this kind of safe space together, which I would think would be top of mind for future moms, and just having an environment where you're going to feel even more safe on like numbers of levels.
Mm-hmm. Yeah, absolutely.
Yeah, and
Yeah,
they're just fun.
so
And I like the skylight
yes. Oh my
or
gosh.
whatever. Right? They're really like we'll have to we're gonna have to reshare your video from 3 years ago, Chantel, to do
Yeah.
another thing. But I think it's just been really great. And so I guess along with this celebratory anniversary of this space, just another great thank you to community. Lisa, I don't know what it feels like as a mom to know that the community you live in raised the funds so that you could have this beautiful birthing space for your family. And we want to see more families like yours bringing their littles up in our town. And that was, like Chantel said, 100% community funded. So that's even cooler at the end of the day.
Yeah, that's super cool that people would be that interested in helping us. Like,
hey, Lisa.
Yeah, no.
Yeah. Well, all these young moms, you're the future leaders of our community. So if you can have a beautiful birthing experience, then, when it's your turn to take over the fundraising, you've got this.
Yeah. Now we just got to work on that pool.
Yeah. We'll say to Kathy and Wendy, it's the secret way that we're just going to recruit board members to the foundation. So we're just want all these future moms to come and be on the board of directors. It'll be great.
Totally. Oh my God.
Thank you, ladies, so much for your time today and sharing. Is there anything else that you would want to say to, future moms or families or any of the donors on this anniversary date?
I think
either one of you.
Go ahead, Lisa.
No, you go ahead.
No, I think I was just going to reiterate what you said, Jody, is just the gratitude that our team, our program feels, and that connection to the community. That's what keeps us going, and the connection between our physicians, our midwives, our nurses, all of our hospital staff, and the community is what makes High River amazing. And so we're so grateful for the opportunity to work with the foundation and our community for projects like this. Yeah.
And even though the renovation has been done, like my experience with every single one of my birth has been like absolutely phenomenal. If anything, actually my first birth was like the best, even though it was in the old rooms, just because like the doctors and the nurses are absolutely incredible. Like the care that they give is amazing. It's like nothing else, honestly. It's so good. So I don't like the room is just a bonus, but your experience is great no matter what.
Yeah. Well, I love that. All right. Well, if anybody would like to, if you're curious about learning more about what the foundation does or supporting projects like this and future ones that we do in the community, we invite you to visit our website at highriverhealthfoundation.ca. Chantel, Lisa, thank you so much for sharing your stories and information with us today. And I guess, Lisa, we hope that you never have to use the hospital again. Kids, you might have to use Emerge a couple of times, but it was really great. And we appreciate you sharing that information today. And have a great rest of your day.
Thanks, Jody. Thanks, Lisa.